Sitting down with Dr. David Klein of the Stages of Life. I'll give you contact information at the end of our segment. But right now, let's get Dr. Klein's take on aesthetic procedures. Good, bad, and different.
Okay, well, we have to start with what are we trying to accomplish, okay, with aesthetic procedures, with aesthetic approach. What are we trying to do? Are we going to take a 70-year-old and make that person look like they're 20? The answer is no, not ever. Are we going to take ourselves a 20-year-old and try to make them look like they're 30? Well, you do that with makeup in the entertainment industry. It's a whole lot easier to do that than it's make an 80-year-old look like they're 30. It isn't going to happen. What you try to do with aesthetics is to make yourself look as good as you can, to try to improve upon what's there without getting silly or getting stupid. Now you can look at surgical procedures, which each and every one of these things have their downside. They have their risks. You know, you look at Joan Rivers. Okay, everybody used to laugh about Joan Rivers. You know, could she drink through a straw? And the answer is probably not. Could she whistle? No. But as it turns out, she died as a result of a procedure that was being done. Okay, and it cost her her life. People die as a result of some of these surgeries and procedures. You can go ahead and you can do Botox. If you read the risks that are involved with this, there are people that it costs them their life. Okay, it is not a lot of fun when you're that person. Tell your doctor if you have Eaton-Lambert syndrome. I have yet to meet somebody that knew they had Eaton-Lambert syndrome before they got into trouble. You know, that's the way these things go. So Botox, yes, it's a very, very safe procedure to knock wrinkles out, but it's very, very temporary. And oddly, when done properly, it is expensive. There are things that you can do to make yourself look younger, and then you can start getting into the fancy. The fancy does not need to be the place that you start. So what do you do for aesthetics? What is it about the skin? Well, I'll tell you what. Okay, you know, if you have a dog or a cat or a cow or a horse, and you're going to take that person to show. Now, you don't take your kid to show unless you're really, into these pediatric beauty pageants, which is its own illness by itself. But if with a dog and a cat, okay, if you want to make them look good for show, you make sure that their nutrition is very, very specific. You load them up on oils. You load them up on the vitamins and minerals that are necessary for the skin, and in this case, their fur, to be nice and shiny. If you want to take your cattle at the 4-H and get a ribbon, you'd better make sure that you feed them properly, take care of them, and comb them out. This is necessary for cattle, but what do you do for yourself? Ma'am, there's not much we can do with your face, but we can really work your skin. What does it take to do this? And you start with nutrition. Then you can take it from there. Now, what I'm trying to allude to is what an artist would do with a canvas. Okay, the first thing you do before you start picking up your paint, before you pick up your brush, is you take that canvas, you wet it, and then put it on a stretcher. A canvas stretcher is very, very important. Then you allow it to dry, and before you do anything more, you prepare it with the appropriate base oils, okay, and that's just necessary before you even start with your picture, okay. That is the way that it has to be. If you're doing pastels, you better make sure that your paper is stretched out properly. You better make sure that all of your equipment is where it needs to be. With aesthetics, you have to make absolutely dead certain that the skin is as healthy as it can be before you start doing things to it. You do things for it first and to it secondarily. And then you got to start using some common sense. Everybody has that neighbor. Everybody has that person in the card club, the person at the book club, or whatever it happens to be, that keeps getting those aesthetic procedures and now looks like something other than a human being. Okay, they start looking like a marionette. They look like Howdy Doody. They start looking a little bit more like a cat. Now, you can take a man and make a man look like a woman with fillers. It's easily done. It does not take a genius to do this. In fact, it takes an unskilled hand to do it. This is not a good thing because it's not always so reversible. You know, you can use Botox. It's very hard to hurt somebody other than stop them from breathing with Botox. But with the fillers, it's very, very dangerous, and it's not something that you want to do at one of these little parties. Well, we're going to go get the nurse practitioner off duty, and she's going to go ahead and she's going to cut us a break. This is really not the place it's done. Okay, this is the way that you make for a bad outcome. But there are all kinds of alternatives, all kinds of cool things that you can do aesthetically that don't have a lot of risk attached to them. And this is where I want to go with it. So first thing we're going to talk about is losing some weight with aesthetic procedures. There are people out there that do cool sculpting. Wickedly cool way to knock weight off somebody's abdomen. Okay, is it expensive? Not terribly. Is it risky? No. Is it uncomfortable? Maybe a little bit temporarily. But beauty comes with some pain. At least that's what they say in the industry, and that's the excuse for the discomfort. Does it work? Yes. My favorite way of going about this is using something called radio frequency. Now, why do I care about this? Because it's really nice to make people feel better. That's easy. Getting people to feel pretty good about themselves is something else. So how do you deal with the ravages of their skin? How do you deal with people that have been out in the sun baking with iodine painted all over themselves? How do you make things better there? Well, for that blotchy skin, you start off with something called hydroquinone. You can add a little retinoic acid to it, and guess what? You nail the wrinkles as well as the blotchiness with a prescription. It's easy. You apply it yourself. You may see a little bit of peeling, you may not, but guess what? The skin starts to do better. You can do citric peels on the face. This is something you do over a 2-day period, and you start looking better without doing damage. It's a little bit uncomfortable. You lose a day with your friends because you don't want to go out there looking that way. But then the radio frequency stuff kicks in. This is interesting stuff where you go ahead and it's an entirely painless procedure whereby you apply a stainless steel wand, an instrument, to the skin. You put goo on the face and you slide this thing over the face, heating it to 41, 42 degrees centigrade, which induces the skin to start kicking down fibroblasts and tightening it up. It's facelift with a stainless steel wand. What does it cost? It costs about 1/8 of what a facelift costs. And guess what? There are no risks attached to it. So when you're looking at aesthetic procedures, when you're looking at the possibilities, when you're looking at the things you can do, look for cost, look for benefit, look for risk, and look for reversibility. Those things are very, very important when you do your shopping for an aesthetic procedure. Go to somebody that knows what they're doing, for God's sake.
We've got about 2.5 minutes, so I know we can't do it all. But I wanted you to talk to our audience. Tell them what you do. I mean, you've got a lot of board certifications. You've got an awful lot of history.
Well, a wall full of I love me stuff up there. And some of it, it doesn't really impress anybody, I don't think. But people ask me this question all the time. What exactly do you do? And the answer is I don't really know. I don't have a good storyline. Okay? So I have enough education. I have enough certifications to do pretty much whatever I want to do. Okay? But my calling, okay, the thing that I find most interesting, the thing that brings me to joy on a daily basis, the thing that makes me happy to go to work every day and unhappy when I have to leave, is diagnostics. Diagnosis of a problem is the highest calling for a physician. Okay, doc, what's wrong with me? Unfortunately, okay, medicine has devolved. It's turned upside down. Okay, where you go to the doctor's office, you may not even ever see the doctor. Okay, this is insane. When I first moved to Orlando, I came down here. I wanted to get a physical because I was heading up a company, and they wanted to get insurance on me. So I had to go there and have somebody do an examination. This was done in Lake Mary, Florida, and I never saw the doctor. Now, when a doctor goes to a doctor's office, okay, you would expect that there would be some kind of courtesy where you go shake the person's hand, thank you for trusting me, so on and so forth. A chef going into a restaurant gets more respect than I got when I went into this doctor's office. Never saw the doc. And when I asked the PA why I was not being introduced, the answer is, well, the doctor never sees the patients. There's a devolution in medical care. So what do? I really enjoy figuring out what's right, because you want to reward that which is right. Have people continue to do what they're doing well, and then to make whatever necessary changes to improve their life's trajectory. So what do? I'm like an air traffic controller with regards to physiology. The Wizard of Oz is an even better selection. I'm able to take people and lower cholesterol without starting statins. I'm able to get people off of insulin using nutrition and nutritional intervention. Picking medications carefully so you get more than one kick for your cat, as it turns out. Okay, and what do? How do I do it? And it's really thoughtful general practice. So I consider myself, oddly enough, to be the most highly credentialed general practitioner around. Why? Because that is really the highest calling, is to bring somebody in and to be able to do that which needs to be done short of interventional surgery.
All right, and you can learn more if you go to suffernomore.com. Suffernomore.com. You can find out more and more about the doctor. Plus, you'll get information on how to get to the Stages of Life Institute, which is a very, very great place with a lot of diagnostics going on. And that, of course, is suffernomore.com. Now, if you'd like to sign up for a nutraceutical program, this is exciting. All your nutraceuticals coming to you on a regular basis. If you take 1 a day, 2 a day, 3 a day, that's all gauged out, and you get the amount you need in 30-day increments. Now, that's great. How do you do it? It's called stagesoflifevitamins.com, stagesoflifevitamins.com. Check it out. You can read up on the nutraceuticals. You can set up the schedule, and you are off to the races with the good stuff that has been assayed. We want to thank the doctor so much for sharing his expertise with us.